Welcome, welcome. I should do what Christina does. Ta-da! So today, you guys have Ingrid today. And I have a guest. This is not Christina. Christina is at home with her mama. She's taking care of her mom in Sweden. So I miss her, but I think I have a good stand-in today. I have a good guest, and I'll tell you about him in a second. But welcome to High Heels Happy Hour, and this is a podcast where we pretty much talk about everything. So if you're coming back, thank you for your love and support. And if this is your first time tuning in, about time. Okay. So as always, we do a check-in and a life hack. So for my check-in and this is something we do kind of all the time. We do like a little check-in, mental health check-in. It's been great. I do have a surprise for the kids coming up. So I'll share with you later what I'm going to do. So other than that, my week has been pretty good. And for a life hack is, we always think about October. We do mammogram. So you do like a boob check. When you get older, you have like a bone check. Then you have heart check. This is your life hack and reminder to do a brain check. So if you haven't had any just mental health check just to see where you're at, please do so, especially during the holidays, kind of see where you're at. Family coming in or maybe family you don't have anymore. It's really important that you kind of see where you are mentally just to prepare you for what's to come. So with that, I'm going to introduce to you my guest. And I have little notes here. So Mr. Adrian Marquez is a retired Marine Raider. And he went from a veteran, he's still a veteran, to a licensed mental health counselor. And he's actually the director of behavioral health at Emerald Medical and the CEO of the Sheepdog Corporation. And he is an amazing father of 4 and an awesome husband. Not of 4, of just 1. So without further ado, and then I'm pretty sure if he has something that he would love to share, he'll say a little bit about more what he did or does. But this is Mr. Adrian Marquez.
Hi, thank you guys for welcoming me. I'm honored to be the first male guest.
That's right. I'm surprised. It's our first male. Yay.
So I'm going to do it justice, and I apologize if I mess this all up.
He has a lot at stake. So today, is there anything that you want to add?
No, I think you got it pretty well.
Pretty good?
Just
Okay.
excited to answer whatever questions you guys.
Yay. Okay. So with that, I made a post on our Facebook page on the topic that we're doing today. So with mental health, and you all know I just love anything to do with mental health. I just think we don't talk about it enough. And something that we brought up was ketamine therapy. And we had quite a few questions come up in the post. And I thought, what better person, is that right, than you to talk about ketamine?
I'll take it, sure.
You'll take it? Okay. And I've known Adrian for a little over a year.
Yeah.
And I've kind of seen, one of the things I love is I've seen a lot of people that I know and not even don't know come through here. And he just has this ability and this heart of just seeing people on the other side, meaning on their way to healing, which is really rare when it comes to mental health. Because sometimes I feel like people put band-aids on stuff, whether it's medication or just enough of a session to be like, oh, well, next session we'll continue. And it's like you never have that sense of like, oh, I'm finally getting some relief.
Mm-hmm.
So for me being, seeing Emerald Medical and seeing you as a part of Emerald Medical, it's been like night and day. So I figured I can't hold them hostage and nobody know about him forever. So, which is why I thought this would be great. So we're going to talk about ketamine.
I appreciate that. That was really nice.
Oh, thanks. Yeah. Well, it's true. So I really have seen so much come out of here, come out of what you do, and it's just really people just need to know that there is. I guess what am I looking for? There is hope.
Absolutely.
A lot of times you feel helpless, hopeless, kind of like when it comes to trauma. You're like,
Sure.
well, this has always happened this way, and it's going to continue to happen this way. And it's one of those things that if you just give in to like not trying and you're like, well, this nothing really ever good happens to me. It's like one of those things you invite versus be like, well, no, like from now on, good things are going to happen. And it's
Yeah.
having that mind shift.
Sure.
And
Yeah.
I think just you giving someone, and sometimes people know, but it's like when you have somebody that you can just talk to and just be like, "Blah, blah, 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 blah," and you're like, yeah, I got you. It's like, wait, you understand what I'm saying? And that is something that you have. And I think it's a gift to
I
be able
really appreciate that.
to.
I think that'll be the first part to kind of like to piggyback on top of, like, for anybody that's looking for
Yeah.
counseling or has tried it in the past and felt like it didn't work. Just know that there's so many different approaches to psychotherapy and the work, and you have different psychotherapists out there that have different ways of looking at psychology and attending to different issues. So I mean, shop around, find one that like works for you, find one that connects with you, find one that you feel is actually paying attention
Mhm.
or helping you inside of those spaces. If you're not getting, I mean, give the therapeutic process a chance with that individual. But if you feel like they're not actually trying to help you achieve your goals or get to those places or working on goals with you, fire them. Find someone else. But continue to work. Don't let it be something that stops you from working on you. I'll be the first to say that there's a lot of bad therapists out there. That's one of the reasons that gravitated me to come into this field, having a heart and feeling a calling to want to help people. So don't let any past bad experiences you might have had with past counselors stop you from continuing to work on your journey.
That was that was greatly said too. Not too shabby. Okay, so you ready?
I'm ready.
All right. So ketamine therapy.
Okay.
All right. So Adrian, how does it work?
Okay. Great question, especially people that are interested in ketamine therapy. They've heard about ketamine therapy or all the psychotropics. All the psychotropics are those different types of medicines used to try to bring about some altered state of consciousness. And they have a bunch of different benefits in there. And again, it's going to come down to who you're working with and what their approach is on there. Ketamine therapy in itself is a unique, different medication that's utilized, and it's one of the first ones that's being seen as being approved for medical use, for clinical use. It is usually administered one of two different ways, through a nasal spray or through the IV method. And ketamine therapy has a really great way of helping people. If you wanted to get the scientific about it for the first how does it work answer, once ketamine is absorbed by the body, it metabolizes very quickly. It turns into a metabolite of norketamine, which works as an NDMA receptor blocker, and that helps us with that receptor is the one that helps a lot of the things that you've experienced in your life get processed into long-term memory, different sensations and emotions, kind of builds that pattern inside of your brain. Another thing that it does is it has a secondary metabolite, hydroxynorketamine, which works as the AMPA receptors, which helps to stimulate neural pathway generation. So it really helps to ignite the neuroplasticity capacity of a person's brain. So while it gives you this capacity to not initially react or feel the same way that you've always felt about certain things, it also turns on another part of your brain that helps you create new pathways. If you looked at a person's mind underneath of an MRI cap, the normal thought path or pathways that they have, there'd be some lighting, a lot of light ups, a lot of connections happening. But when a person's under a psychotropic, it looks like an intense fireworks display. The medication, when it attends to you, it causes parts of your brain to communicate that haven't talked for a very long time, or maybe even made those connections before. And it gives us this process, this space to kind of get out of our own way, not to immediately react or think or perceive things the way that we've always perceived them to be, and open up that other part of our brain to try to make new neural connections, new pathway formations, to try to restore some of those spaces.
I heard get out of your own way in a party. That's pretty awesome. No, that's pretty cool. I think it's cool. Okay, so I'm gonna go over a couple questions we have here. I think you answered a few of them together. Another question that was asked was, can it help with treatment-resistant depression that has not improved by other therapies?
Yes, so that's actually one of the main reasons why people be referred to participate with ketamine therapy. tried other depression medications, anxiety medications, and they haven't had benefits with it. A big benefit of ketamine therapy is that while a lot of medications usually take several weeks or even months to start to see effects, with ketamine therapy, you start to see effects almost immediately. Within that, following that session, or within the first few weeks, you start to see this, what we call this window of plasticity. The way that the medication works within the brain and the release of glutamine in that space, you have this capacity for new neural pathways to be formed, and you see almost an immediate reduction of a lot of symptoms. But then there's also that space of how you're going to continue to attend to your therapy and the treatment protocol that happens. That's another, I guess, question to kind of add into how does it work. Um, the difference between like the nasal sprays and the IV treatments as well. And the IV treatments usually go to a place that's going to have a protocol, which would be sometimes 6 sessions, sometimes 8 sessions. And wherever you go, please do not think that ketamine therapy is something that should be just a standalone treatment. It
Mm.
should be done with some kind of behavioral health intervention, some kind of a therapeutic process inside of it as well, too, as far as getting prepared for what the process is going to be like, what the experience is going to be like, and the integration that you should be doing in between those sessions as well too. Processing the cognitions and the images and the discoveries that you have within those sessions. So that's the IV side, and the nasal spray side. That's usually administered as in every so often the person's going to come in and continue to take a nasal spray. It's usually a lesser dosage and see more almost as in the formation of microdosing. And that's when you'll see
Mm.
people give in. Ketamine was kind of put on the shelf for a long time. I mean, if you want to get into my feelings on big pharma and how that process works. Like they were not too happy to see ketamine therapy emerging so well because it was helping people. People were actually finding resolution to the issues and the complexes that they've had that have caused their depression or caused their anxiety. And big pharma was losing their return customers. So a lot of the forward movement with it got put on hold until pharma had a way to kind of make it a microdose, something that you're going to come back for more and more. There's definitely benefits for people that are doing the nasal spray ketamine as well too. So I don't want to just, I'm not just trying to completely knock that. But if you're looking for some significant work to do when it comes to attending to the depression, the feelings of depression, feelings of anxiety, past trauma processing, I would encourage you to find a place that does the IV ketamine protocols with behavioral health therapeutic interventions throughout the process.
Yeah, I was just thinking, people, there's a bunch of like pop-ups with like
Mm,
ketamine and stuff, and it's so important to have someone that you've either established with or can really understand what actually happens in that space. Because some of the stuff that you see, it doesn't look like anything. But when you say, okay, this is what happened, or this is what it felt like, um, I myself experienced it. At one point I was like, I felt like Baymax. And my therapist was like, oh, I know what that is. I was like, oh, good, because I don't know what that is. But it's really, really important that you find someone or a group that can help you through it, because some of the stuff is really, there's no,
yeah.
it's not very clear, but yet clear.
Yeah, and there's a growing field of psychotherapists out there that are getting trained and having a better understanding of psychotropic assisted behavioral health therapies, because you also have out there a lot of materialist psychiatrists and
Mm.
formations of dealing with it, where there is a physiological effect that happens in the brain, and some people still feel like it doesn't matter how much trauma you've had, it doesn't matter why you're depressed or why you're anxiety. If we just balance out those chemicals in your brain, you should be good. But there's a big space of, if you've had a lot of trauma and things in your past, how are you going to reprioritize, reattend to your spaces, life afterwards? Ketamine therapy and psychotropics has a beautiful effect. You take some medications like oxy, right? Your body feels euphoric or feels good because of the medication, but your brain knows I only feel that way because of this drug. So you start to have a
Mhm.
desire and a craving for that medication. And psychotropic therapies, these are neuropathways that are available within the mind. They're there. Usually it's been because of something that's happened in your life or in your past that causes us to not want to think about those things anymore, not want to feel that way anymore, not want to go to that space in my mind anymore. And your brain, kind of like a network of rule roads. You continue to take this path over and over again. I don't want to go that way anymore because of that hurt that happened when I was a kid, or in my first marriage. I don't want to feel that way. I don't want to leave myself vulnerable to those spaces anymore. So your mind kind of goes down this pathway of thought, which might be more pessimistic or depressive, or well, however it might be, but you go down that road so often, it starts to become a rut. And now all of your thoughts start to be in that more kind of negative orientation. This medication helps to attend to those neural pathways that have always been available to you. And think about it as in like all of the roads, all of those networks of the mind get repaved. The paths that you haven't taken for a long time, the nature has taken them over again. Grass has grown through those rural roads, trees have grown through them again. But through this protocol, all those roads get repaved. That rut, it gets filled up again. That window of plasticity that I mentioned before, it's after these treatments, after these protocols, you have a greater potential to take any action, any choice, not just the ones that you've just become so familiar in taking over and over and over again, in that space.
I'm in. Sign me up, right? Okay, so this one is I'm gonna kind of put three in one because I think you can probably hit all three. So does it help with suicidal ideations? Does it help with sleep? And does it help with anxiety?
Okay. Uh, yeah. Yes. Yes. So suicidal ideations, it's becoming a more emergent treatment when people even show up in the emergency room for having these types of, suicidal ideation, suicidal intents, for like
Mm.
an immediate treatment modality. Now, once again, that can help that person in that space, but it should be followed up with therapy, followed up with treatment to try to help the person unpack all of the events and the consequences of the situations that have kind of like put them into that space. Can it help with anxiety? Yes, it can also help with anxiety. It helps to calm down that hypothalamic pituitary adrenal axis, that fight or flight mechanism inside of you. A lot of people talk about these when you do the integration space. A lot of people talk about feeling in this space where they're floating in space or feeling weightless, and they realize that they just were not stressed or overburdened or feeling bothered by any of the things that were happening inside of their life. It's a disassociative anesthetic. Same thing that they use in a lot of emergencies, administered in a different way, but has the ability to help your body in that NMDA receptor antagonistic space to calm the way that your body would normally react, especially that connection between the hippocampus and the frontal lobe, which is where a lot of your fight or flight reactions would take place in that space. So it can help with that anxiety space. I tell a lot of people it's kind of like the beast or the bear of anxiety inside of
Mhm.
you gets put into hibernation while you're underneath that treatment. And then once the treatment's over, it's kind of like real hibernation. It's over, but that bear kind of wants to stay in his cave for as long as he can. Noise of life outside of that cave will get loud, and it'll eventually rouse that bear up. But instead of idling at a seven, like most of us do every day, you'll be in that space where you can feel yourself experience it get to a one. And if you're doing it with therapeutic interventions and you're doing grounding work and breath work techniques and like, ways to attend to your anxiety, you can start to learn how to, when I feel it's at a one, instead of saying, yeah, that's not that bad. I'm used to it being at a seven. I just don't have to worry about it right now. Bring it back down again. Then the next day, more things happen. You feel like get to a one or a two. How to bring it back down again. Getting a better sense of what your experience of anxiety is, how your body's physically carrying that anxiety, and how to attend to yourself inside of that space because you're able to suppress it, relax it, and then get more interoceptive in how your body carries that so you can attend to it as it starts to rise up.
Love it. And then does it help with sleep?
So in the space of can it help us sleep, I want to say yes again too, because a lot of times our
So
sleep,
yes, yes, yes.
because a lot of times our sleep issues are riddled with the anxiety and with the depression. A lot of times people come out of those treatments and they feel great. They feel energized. Like they're like, I don't know what I've been so worried about in a lot of spaces. Every once in a while, we'll get somebody who's just exhausted. Like they're just like, I need to go home and take a nap. And a lot of times it's those are the ones that have been so chronically overwhelmed with anxiety. It's almost like their body's just been fueled by those stress hormones. Now that we've shut that thing down, they need rest. Like you really need to reset your system and let your body get some rest that is needed. Usually that only happens that first session, and then afterwards they start to feel that rejuvenation space after those treatments as well too. So can it help with rest? I definitely do think it can help with rest. And a lot of people feel like their dreams are ignited as well too, because there's a lot that takes place in the subconscious or the theta wave brain waves, which is where a lot of your dreams come from as well too. You do the protocol, you let your mind kind of have some space to exercise within that realm. A lot of people would come back and say that their dreams have started to pick up, almost like they're still processing and working in a very similar space that they felt that they were in that medicine space too.
I love that. And you all know I've been super open about mental health and what I've dealt with. And one of the things that I really, really thought was just like, wow, was after my first ketamine treatment, not to feel any anxiety. Like my brain was so quiet. I was like almost hitting my head. I was like, no, no, you gotta think of something. I was like, no, no, it's like there's something. There
Trying to
wasn't.
find it. You're trying to
Yes,
find
I was
something.
trying to find something, and I was like, holy moly!
Hmm.
The thought that not just I'm pretty sure it's not just me, but the thought that society lives and thinks that they thrive on a constant,
Chronic burden.
yes,
Yeah. A lot of people
uh,
come out and say they feel lighter, like there's a weight off the top of their body,
yes.
you know?
Like, but to think that we've been taught, or I guess caught that we're supposed to be stressed. Like we're supposed to be multitasking. I think multitasking is just a room for like a bunch of errors at once. So that's just my, people will beg to differ, but I just think you should just focus on one thing. And we're so used to just go, 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 and we're supposed to do this much, where in that space you're just like there at that.
Oh yeah.
In it, for
It's
me it was mind blowing.
it
It's just
I've loved seeing I love when I see people come out of it and I just see them, looking at, like the decorations on the wall. They're looking at something with so much more intent. Just
it's like, oh, this is a
Yeah,
chair.
I did not notice the details of these things because your
Mm.
brain is just so busy with trying to carry all of these different thoughts of what has happened and how am I going to anticipate to deal with those things that are coming in the future. Your body metabolizes the ketamine so quickly as well too. It's funny when I have a client do the integration the next day and they'll call up and they'll be like, "I think I'm still a little high right now." You're not. Like your body has metabolized the ketamine out at this point in time. Perhaps this is what it feels like not to be underneath of that chronic constant weight of anxiety. Now, some people wake up and they feel like they're missing something, and they don't realize what they're missing is their anxiety. It's almost like, "Where's my wallet?" But it's not your wallet; it's this anxiety that you have all the time. To feel that euphoria of just not carrying that weight is a beautiful thing to see people walk away with.
Yeah, I think that was one of my probably the favorite my favorite thing to experience. It was awesome. So I know you mentioned about the was it Oxycontin, right?
Hmm.
About how that medicine kind of works. So I kind of another question we got asked is it addictive,
Hmm.
as far as the ketamine, and is it good, or does it help someone that's in recovery?
Okay. So yes, it is not. Oh, sorry, it is not addictive. Studies are showing that there's not addictive, and we're talking about doing it in the clinical setting, right? We're
Mhm.
not talking about Special K behind the club or doing it,
Oh my
with your
gosh,
friends
please
at
don't
home.
do that.
No, not at all. We're talking about within the clinical setting. They're not seeing signs of addiction
Okay.
coming off of it. It's not a space where a person's craving that substance. More than anything, they're looking for the clarity of mind and the absence of anxiety and the suppression or the reduction of the depressive symptoms that they have
Mhm.
after that space. But again, those are all neural pathways that you've always had available to you. So in that behavioral health intervention space, it's like, I'm glad that you're feeling this. I'm glad that you're recognizing, that you don't have to be so worried about it. What are you going to do now? Like, what are you going to choose to reprioritize in your life? How are you going to rearrange things? You can't go back to life the way that you've always been living it and expect things to not change or stay the same. Like, you have to make changes. So what are you going to do differently to keep this neural pathway that you've always had available to you, that you were just reminded of, that you were just able to recognize? How are you going to keep that pathway clear? So it is not addictive forming. And what was the other question? Oh, for
For
recovery.
recovery.
Yeah, in a lot of spaces, but especially with a lot of addictions, there's usually some formation of trauma. There's usually some formations of stress management, trying to escape some cycle of discomforts, recognizing what's at the core of all that, like what's at the center of all that, and giving a person space to process those things. What have I been trying to escape, get out of, not try to attend to, not try to feel, so that they can actually try to get through that and realize they don't need substances to help them just go numb from it.
A lot of people try to go numb, and it's kind of almost like a default thing people do, or things that people do. It's just,
Yeah,
it's what is it, out of sight, out of mind?
yeah.
But it's actually not out of mind.
Mm-mm.
They think it is. So we talked about how it helps with sleep,
Mhm.
anxiety. It's not addictive.
Mhm.
It helps with recovery,
Yes.
possibly.
Yeah, it can.
Okay.
It can.
It can. Okay. We also talked about how it helps with suicidal ideations, and how it gives you the space of that sense of just clarity, the beginning of healing. Okay. So now let's get to who. could not, like, if somebody came in, what are some things that you're like, well, this person probably could not get ketamine? Because there's certain medical maybe diagnoses that may not be suitable for ketamine.
Oh, great question. Yeah.
So,
Yeah. So unlike a lot of the other psychotropic medications that you hear people talking about, ayahuasca and psilocybin, and ketamine is one that when it comes to people on other medications, there's very little complications that we need to worry about that. Matter of fact, people that can't do a lot of other medication spaces can do ketamine therapy and get a lot of get those benefits out of it. Now, however, there's some behavioral health diagnoses that you would not be suited for, and that would include dissociative identity disorder, schizophrenia, and bipolar type 1. Ones that have like intense mania associated with it as well too. Anything that really has like that those intense behavioral patterns that can be or fracturing, splintering of personalities.
that's good to know.
Mm-hmm.
That's so interesting. It blows my mind. I've done the ketamine, and I still think it's mind blowing. Like all that it does and it offers. Um, and then let's see what else. Do you have anything else that you can think of?
Yeah, I think to kind of give clarity, I gave a quick metaphor and kind of a detailed explanation of what's happening inside of some of those receptors. But what you're participating in ketamine therapy is you are consciously participating in a subconscious process. So in that medicine space, your brain waves are going from, we're regularly talking and operating in beta wave down through alpha into the theta wave, which is where a lot of your dreams are taking place. And you are allowing your consciousness, basically giving it a ticket to a space where it usually doesn't get a chance to attend to. So in a lot of that preparatory work is learning how to be able to be okay, to let yourself just be in that space. Your job's to do nothing, but don't prevent anything from happening. You don't need to make sense out of this because this is where those other domains of your mind, the subconscious or unconscious spaces of your mind are able to attend to things. A lot of times we'll talk about, internal family systems when they're talking about these types of treatments and the different parts of our mind. And throughout your life, you've had parts of your own psyche that have been injured. We call them the exiles, ones that have tried to run and organize things, the managers. You have the protectors or the firefighters that try to protect the wounded parts of the brain, put out the fires, even if it causes them to have to break down that door, punch through that wall. Sometimes it's destructive in how they try to protect. They communicate and they attend to each other in a completely different way of communication than we do in our conscious mind. A lot of symbolic manifestations, just like our dreams do. So you are consciously participating in this dream state. And these medications are letting your brain go down into that theta wave. It's a disassociative anesthetic, so it's allowing your body to go numb as long as you let it sit and rest inside of that space. And it's allowing you those other parts of your brain to have this, like, they communicate more through like this cathartic manifestation of experience through symbolisms and images. It's like this beautiful interpretive dance of symbolisms, just like your dreams do in a lot of spaces. So it's not scary. I think one of the questions I'll jump into was like, am I going to see purple dinosaurs,
Pink elephants and aliens.
pink elephants? I can't say you won't. I can't say you won't
Maybe
see
a purple dinosaur.
yes,
I'm just kidding, just kidding.
skittle farting unicorns and like marshmallow land. A lot of people's first session when they come in, we call it their frame of reference dose because it's their ability to get comfortable within that space. A lot of concerns and fears people have. To experience that medicine space and the start of it, to have maybe even that first conflict with that, what they call like the ego death. I don't like that term so much, more like an ego resolution, or you have to attend to it. But the images that might come up, there's significance. There's a reason why your mind is bringing those images up inside of that space. And it might not be concrete, like like skittle farting unicorns and dinosaurs. It might be colors. It might be different experiences, sensations, cognitions. It's difficult for us to explain what happens inside that medicine space because all of our ways of communicating and the way that we describe stuff comes from this this physical realm, this physical world.
Yeah.
All of our words are meant to describe what these meat suits engage with all the time. When you go to a place that's a very hyper conscious theta wave space, your mind can have fractured images and little pieces of things that just elicit emotions and they allow the psyche to attend to the wounds. When that exile says, hey, I've been hurting for so many years because of this. It might be through the manifestation of an image that releases an emotion. And the next part of your mind is going to say, yeah, but don't you remember this? And it's the next image, which is a soothing, comforting one. It's emotion. And to us, like, this makes no sense. And that's okay. It's not meant to make sense to us. It's the rest of our mind and our psyche getting a chance to attend to it. That's when you have strong integration. Afterwards, you can start breaking some of those pieces down. more often than not, like I'm wondering if you had the same experience where like if those pieces and those elements, you're like, oh, that makes sense. With the story of my life, with the things that I've been through, it makes sense why my mind would be attending to those different things in those different ways.
No, definitely. I mean, I remember talking to a dear friend of mine, and I was trying to explain to her like what I was feeling, and her eyes got bigger and bigger, and I was like, "Oh, you don't get. I can't even explain to you what I felt or what I saw because it doesn't make sense to her."
Hmm.
So, because they're like, "Well, what happened?" And I'm like, I feel you just feel different,
Hmm.
and it's a good different." So while you're talking, the next question that kind of popped in my head, and this is just me asking, just in case someone's curious, is at what point, in what space should or could somebody be in to say, you know what, I think I want to try ketamine because it's not like for me, I was probably at my max of where I felt like I something's got to give. Like, I was just like, okay, I was like, I could just see myself just saying, okay, either I do this or I'm not sure what's gonna happen. So for me, it was like I needed to do something.
Yeah,
I needed to do something, and I felt like I didn't know where to go, didn't know where to run to, didn't know what to say, didn't know how to, and I just thought if this could help, why not?
sure. Yeah.
So where should a person so basically my long short answer after all that, I was in a state of like desperation. I was like, okay, what would it be for me just to be okay, to feel not anxious, not stressed? Like, is that really true?
Mhm.
So somebody coming in, like, what would be a great indication that, why not? Like, what's their mindset should be? Because I came in like desperate.
Yeah,
Like I was like, somebody please help me to be quite transparent,
sure. I
you
appreciate
know?
that. Yeah,
Um,
I respect and
but
appreciate that.
but as far as like what should it look like
Yeah,
as far as
I mean,
that?
without a doubt, like where you started, we'll start there and like keep working in different directions. But I mean, the individuals that are feeling like they're out of options, they don't know where else to
Mm,
go. It's I hear it quite often. Like I'm concerned, I'm afraid, I'm worried about giving that a try, but I feel like I'm out of options. I'm like, well, if you feel like you're out of options, this is an option. Like let's give this a try before you want to quit on yourself and everybody else around you. Like let's definitely give this a try. If you've been through a lot of trauma, and sometimes that story of the trauma that we experienced, it might have been, back when we were a child, that set forward this lens, this experiential lens. And I've seen life through the lens of that trauma for the rest of the years of my life. And everything that's happened from that point on forward has been through the lens of that trauma. And then the next series of events happens, and I'm walking through with the next two lenses in front of me. And just to have this space to step out of the old story. There's a lot of times people hear great advice and they're like, yeah, that's really good. That could probably help somebody else, but like not me. Maybe somebody else can get benefit from that, but not me. No, usually that advice is good for all of us, but I have to get out of my own way and my own past experiences that have said that make me think that that's not good for me. Like there's a reason I'm feeling that, and perhaps if I could just step out of my own way, I can let that good advice settle where it needs to be. So people that have been dealing with chronic depression, lifelong depression, seasonal depression, chronic anxieties, feeling like they have, and phobias. I have a fear of something. I have anxiety towards certain things. It's been pervasive, or it keeps coming back up over and over and over again. Um, Past hurts and betrayals, even in that space. People that struggle with sense of self-worth and self-love. A lot of that comes from experiences that have happened in your life that have spoken some kind of a curse before you or over top of you, made you feel a certain way about yourself. um, there's a lot of great spaces. I mean, you don't have to just be coming to it from this place of from desperation. This can
mm.
also be a space where I'm ready to reframe the way that I see things, to try to look at it differently. I just had a big life change, a big career change. The kids just moved out of the house, or like these things are happening in my life. Big changes, and I want to see things differently. I want to give myself an opportunity to perhaps appreciate it from a different perspective, and have that differential, the disassociative kind of an experience in a healthy, safe space that you can see some of the same things that you've been through or your life from a different lens, different angle.
Great answer.
Thanks.
Well, and talking about that, I believe everything happens for a reason. So I'm not regretting where I was. But at times I'm like, gosh, if I would have just known this a while ago. However, I wouldn't be the person I am today without everything I have gone through. So
Mm.
some things I'm like, it kind of stinks. But at the same time, I'm like, would I be the same person I am today?
All right, that's heavy. That's deep, and that's true. I mean,
Yeah, that's a whole another episode.
it could be.
No, but you think about things and everything you go through,
Mm.
good, bad, or indifferent, shapes how you are, how you think, how you treat people. And I think that's not I think. I know that's the biggest part of when you say disassociative. Like you don't think of what ifs. You just look at it and say, and you keep going. And it's like for the first time you felt like, oh wait, what that person did to me had nothing to do with me.
Yep.
And you're just like you just take off that load and you just drop it off. And it's so freeing.
Yeah.
It's just I think it's like magic.
It can feel like that.
Yeah.
The story that somebody else has told you about your life, just that interaction that you
Yes.
had, being able to look back and realize, it's not like you're just going back through the time reel of your life and we got
Mhm.
to pause and reframe and relive and re-experience
Yeah.
everything. You don't have to go through every trauma. Like I mentioned before, a lot of times it's just this manifestation of something, cognition, thought. It can be a color that just releases that feeling, so that we can have that brought forward, and then the rest of your psyche can attend to it the way that it's going to attend to it. And sometimes it just breaks us free of this belief that we've had about ourselves or towards life and different aspects of life. We can't change the past, but you can look at it and you can realize, man, I've carried that for a long time, and I don't need to carry that anymore.
Mhm.
I can release that. And when you come back to it, when you come back to this space now, you can choose if that decision that I had to make when I was 12 years old, do I still want to continue to bring that with me? Or should I reclaim that part of myself that I had to let go of on that phenomenological walk, reincorporate that part of my inner child, reabsorb that individuation process, reabsorb those lost elements of myself. And by doing that, by recollecting those parts of ourselves that we've lost along our journey, perhaps I can see today and attend to the things today from a completely different perspective, a completely different lens.
I think that's awesome. Okay. I'm giving you guys a second just to listen and really like absorb what Adrian just said because it's just mind blowing. Literally mind blowing. I think it's pretty cool. So I know you, but I want them to know you with what you did, in your background. And you had a couple of jobs in between your service and going back to school,
Mhm.
which has probably guided you and helped you to what you've become now and what you started. So can you share a little bit about kind of how everything kind of shifted and share about how they can find you, what you do, and what you offer?
Okay.
One, two, three.
Yeah, yeah. So I mean, I've had a pretty interesting journey, I guess, to get to the space.
Mhm.
Did my time in the Marine Corps, was joined pre 9/11, was infantry. Then I went to recon, to force recon, to Marine Special Operations Command. Got medically retired out of that, and then that short time in between, I ended up somehow working with the DoD and NASA. I was the Astronaut Survival and Personnel Recovery Office for a little while, which was interesting. It was fun, great job, but my heart just wasn't feeling called to that. I kept feeling this calling to be working with people and helping people, which brought me to go to grad school and become a mental health counselor. And a lot of that also had to deal with my process of getting medically retired and working through the system and working with people that I didn't feel understood me, and wanting to kind of be something that I wish I had in some of those spaces as well
Mm.
too. And then when I became a practitioner, to kind of recognize how healthcare really is and the struggles that there are in this space, and that so much of what is considered best practices is really about medical insurance companies and
Yeah.
and what they can get reimbursement for and what they're willing to cover. And that made my heart ache in a lot of different ways,
Mm.
especially working with veterans and first responders. So that's why we started the Sheepdog program up, which is a nonprofit that's directed to help veterans and first responders specifically, and being able to give them the care and the services that they authentically need. Trying to bridge that gap between what providers will be able to give because of insurance limitations or the healthcare limitations, get them to treatment when they need the treatment. Being able to run, like, I mean, from my opinion, like an authentic nonprofit. I mean, everybody that works for it or volunteers for it is a practitioner or in the healthcare field that just completely volunteers their time so that any penny that comes into it goes directly towards actually helping those guys get to where they need or getting the care that they need. And I've been blessed to find some great people that we created Emerald Medical with. So to be a partner of Emerald Medical and be able to serve as the director of behavioral health for it. That's where we are for our open practice all folks of life, all walks of life, all people in the community. So Emerald Medical is the practice that we're at, a full service provider from primary care with our medical side to mental health side as well. And then for the sheepdog program, which is where we do the nonprofit work.
Yes. So my mind is racing because of all this stuff we're talking about. So I will link all the places on the show notes, so you'll be able to blah, blah, blah. See, that's what happens. I'm thinking too fast. I'll link Emerald Medical, the sheepdog, and you guys have probably seen me post about that because I just adore, and I think it's just the fact of when we talk about having someone understand when you go to therapy, it's really, especially when you're a veteran, a first responder, there's so many things that you see, hear, and do that it's life or not. And you come home, and one of the things I can think about when I talk about veterans, I'm not a first responder, but as a veteran, when a veteran leaves to go to serve, I've established that the family is seeing, this person leave, right? And we do our tour, we do what we need to do, we make it home. Some of us lose friends over there, so we make it home and we're a different person, but our family has left or is wanting that same person that left to walk through those doors, and they're no longer there.
Yeah.
And it is the hardest thing to us to understand. I mean, now I think we both understand we're not the same person that left, but when you have these young kids, leave 18 years old, leave overseas, come back, they're kind of thinking, wait, is something wrong with me or is it what happened to me? So just having all that understanding and having facilities that help, I think is priceless. Because I work with the PTSD support groups and we've teamed up. A lot of our clients or people that I meet around, you're like, this office is like my go-to. I'm like, oh, I know this person, I know that person. Because I just believe in what you guys do. So it's been awesome. So I know that you all are at the edge. I think you probably pulled over at this moment because this podcast is so good. Not that the other ones have been good, but I think this is like it's really great information. So keep the questions coming. If you have any more questions, I believe we could probably do other episodes on this because I know there's a lot more that we can talk about. I know you mentioned ayahuasca
Yeah.
as well. That could possibly be an episode. Maybe. Ta-da. So, well, thank you. So, again, I miss Christina, but Adrian did pretty good. I mean, they both have short hair. So,
I'm no Christina, so thank you for your Scott.
and then we don't have wine today, so we're going to cheer with water. So, cheers. Thanks. Until next time.